have probably missed out can jump in. So let's get into it anyway. I'm just going to share my screen here, guys. So just give me a yell out yes if you can see my screen here. Can you guys see the screen I'm showing now? Just potentially not. Let's just check in.
Nope, it's not sharing yet.
Not sharing yet. Okay, let's start again. Cool. I'm having a shocker, aren't I? Here we go. Let's try now.
Yes, can see it.
Awesome. Brilliant. Thank you. And again, apologies. It's weird. I do these every month and having a bit of a shocker with this one. So anyway, let's get into it. I'll just present so you can see the full screen. Awesome. Thanks. And thanks so much for being patient, and sorry about the stuff around for those that have just jumped on. Yeah, we had a bit of a weird link going on in the invitation clearly. So we'll have to double check that one next time. But thanks so much for jumping in. I've just mentioned to these guys that I am, well, not only am I sharing my screen, but I'm recording this as well. So if you do, there'll be absolutely no offense taken if you need to jump off early. And if you don't get it all in, it'll be recorded anyway, so we can go through that. So thanks for that. Cool. I can take a little bit of a breath now. That was a bit of a panicky 10 to 15 minutes there, but thanks for being patient. Josh Lambert is my name, and I'm from Pinnacle Health Group. We are a wellbeing program company, so we deliver wellbeing programs to over 200 workplaces. So the whole idea of today's session is to talk about health checks, and it's something that I'm very passionate about myself and have been talking about a lot. As I mentioned, sort of once a month, we do sessions like this, and health checks tends to be the most popular, particularly this time of year. So it is going to be a fairly interactive session. I'm using a program where I'm going to ask you a few questions as well and to get your input. And again, if you're watching the recording of this, you won't get a chance for that input, but really you can go through the same process as well and kind of ask yourself those questions before you start to think about health checks for your workplace. So let's get into the session. We're going to go through health checks. We're going to talk about what a health check actually is and why to do them in the workplace, where they fit in the workplace health sort of atmosphere. That there's lots of talk about workplace wellbeing and wellbeing in general at the moment. It's probably in my sort of 12 years of doing corporate health and workplace wellbeing, it's been the most spoken about topic at board level or at executive level or leadership level at different organizations. So it's certainly it's a good time to be in wellbeing, but in the same time, it can be quite overwhelming. So potentially if you're on this call at the moment and you are going through that process at the moment, every person within the organization might be looking at you saying, what are we doing for wellbeing? Or when are we doing this? And when are we doing that? And don't worry, you're not on your own. That's certainly what we help out a lot with. And we'll talk through sort of ways to be structured around that moving forward. We'll talk about delivering workplace health checks. As I said, that's really the nuts and bolts of today's session. And we'll talk about where it fits in sort of moving forward. Obviously, the workplace has changed. There's lots of working from home. I'm dialing in from home today. And how do we really scale health checks as well as wellbeing programs to this new hybrid way of working? So thanks again for jumping on, and so sorry to all of you for this stuff around before. But yeah, great to see you've hung around and stayed patient. So thank you. All right, bit of an intro here, and I'll try to sort of use this more as just a way to introduce and give some, I guess, gravitas to why I feel like I can talk to you about this topic. Not so much a sales spiel or anything like that, because, you know, we, as I said before, we work with over 200 workplaces. We're very, very passionate about what we do, and we've got a broader community that we help with. But really, if nothing else out of today, what I want you guys to get is that health checks are extremely important and there's something that you can do, but it's really about the practicalities of it. And everyone sort of says wellbeing is important and health checks are important, but I like to cut to the chase and sort of talk about, well, this is how you can do it. So whether you go with us or whether you find health checks or you do some other parts of your wellbeing program externally, I've done my job then. So hopefully you can leave today's session with that. As I said, I'm from Pinnacle Health Group. So you can see myself and my business partner, Tom Bosner, down there in the bottom left corner. We've been running Pinnacle Health Group for 12 years now. Our sort of earliest claim to fame, if you like, is that we set up, we're physiotherapists by background, and we set up the first purpose-built employee wellness centre at ANZ Bank. That was way back in 2009 that was built. So since then, we've really sort of honed in on what it is that we do really well, and that is employee wellbeing programs. So we work with 200 workplaces. They're not all as big as ANZ and not all as well-recognised brands as that. So that's anyone. We work with anyone from sort of the big corporates that I've mentioned there through to small businesses and SMEs. And we're extremely passionate about wellbeing in the workplace. We sort of, our throwaway line is inspiring healthy change. And it's something that we really drill down on in everything that we do. It's our purpose, and it's what everyone that works for Pinnacle Health Group is really aspiring to do. So that's a bit about us, just broadly speaking. And as I said, I won't turn this into a sales pitch, but what we really do is we help organizations with their wellbeing strategy. So wellbeing strategy being the ability to map out things like health checks or a 12-month wellbeing program, and discussions such as this, where we get to sort of ask questions and share frustrations about employee wellbeing programs and those sorts of things. The second thing that we do, and probably our signature, are our wellbeing programs. So they're sort of the built-in wellbeing programs where we have some off-the-shelf programs that we've spent 12 years really honing and perfecting. There's some more customized wellbeing programs. There's digital wellbeing programs, but that's another big part of what we do, probably the biggest. And the other one I alluded to before are wellness centres. And we only do a few of those. They're sort of more relevant to property groups and maybe some of those larger businesses that I mentioned. So excuse me for a moment. Okay, let's move on. Now I'm going to press the cough button here. I've just got a bit of a tickle in the throat, so I'm just going to press the cough button like they do on radio, wherever it is. And if you're watching this recording, it's going to be an absolute shock. Already we're 15 minutes late and I've started coughing all over the shop. So apologies for the recording quality and thanks for those that are sticking around. Just the slide that you can see at the moment. So Pinnacle Health Group, this was something that we have always been striving towards, and it's much bigger than what Pinnacle Health Group does. But the start of COVID really forced our hand with this, and we've designed and we've created a community called Well Workplace. And some of you may already be familiar with this. We've got a podcast. So Tom, you can see down in the bottom corner, hosts the podcast. The podcast is fantastic. I think it might be up to sort of 60 or 70 episodes now. And apologies, Tom, if I'm selling that short, but it's a fantastic podcast. He hosts a range of different wellbeing leaders from different organizations. There are different service providers from different aspects of wellbeing. It's a great listen, whether you are an HR person, a health, safety and wellbeing person, or you're just someone who wants to maximize or optimize your own wellbeing. It's a really good listen. So I encourage you all to get along to the Well Workplaces podcast and have a listen there. And added to that's our community. So beyond the services that we provide to workplaces, we're very, very passionate about Well Workplaces and inspiring healthy change. So we've got a newsletter that goes out. We run events such as this and various things throughout the year. We're really keen to get back into some of the in-person events as well. So watch this space, because we'll probably start rolling those out. So if you can get along to any of those, it's a great networking event, but also a really good opportunity to hear what's going on in the world of workplace wellbeing. All right, so what you're all here to listen to today and talk about are employee health checks. So employee health checks are pretty much they're the most popular service that we deliver at Pinnacle Health Group, and we actually package our health checks into a broader wellbeing program. Health checks are super important, and our saying or our justification for this is that really what you can measure, you can manage. It's not our saying. It's a very well used saying from someone who I don't know. But basically, you need to have some data metric before you can really do employee wellbeing well. So if we say that again, you need to really measure something to then provide an intervention to see if you've really made it work. It's probably us coming back to our physiotherapy roots a little bit, where it's sort of assess, treat and reassess. But certainly employee health checks are super important, not just for the benefit that they provide on their own, but they're certainly important in the scheme of a broader wellbeing program, because they can justify the spend, the time and the effort into the other parts of the wellbeing program that you've delivered. So this is where I'm going to get you guys to get involved here. And again, I'll say it again, because I know there's been a few people jumping on quite late. Massive apologies for the bit of the stuff around earlier on. Thanks for jumping on and being patient. I really appreciate that. We've got here at the moment, we use Menti, and Menti is like a live poll. So if you go to, normally I get people to open up another tab on their desktops, or they can jump on their phone. But if you go to menti.com, and if you type in the code that we've got there up the top, so 19236819, you will see this question. And I basically, it's a very simple question. It's a yes or no answer. Have you delivered health checks at your workplace before? And this is a bit of a live poll of you guys that are on the board here at the moment, those that were patient enough to hang around. So you can see there we're getting some responses flooding in already. Thank you kindly. I'll just wait for a few more to come in. So you go to menti.com and type in the code there. This is probably serving two parts here. This is probably just to get a nice snapshot of all of us and to see whether we've experienced health checks at work before. But two, it helps me as well. So if everyone was saying yes, I probably would not spend as long talking about health checks and the why and so on. But that's a fairly good snapshot. And obviously the assumptions that we often make in these sessions that we run are that everyone jumping on here is someone that works in health and wellbeing for their workplace, or someone that is sort of looking to roll out health checks. But that's a pretty good snapshot and fairly reflective of the broader data that we capture, which I'm going to talk about later as well. So thanks guys for getting involved there. Appreciate that. And also probably just to say as well, as much as I've butchered the start of this session, jump in at any time. There's a chat box there that you can ask questions, interrupt me at any time. Probably give me a chance to clear my tickle in my throat anyway, and ask any questions, because really I want you guys to get out of this session whatever it is that you need as well. So thanks for your contribution there. Let's move on. So health checks, what are they? Well, they're really an ability to assess health and wellbeing of the workforce. Obviously, they're delivered to non-working people as well, but we're speaking specifically about health checks to the working population. The main reasons for delivering health checks are to identify risk factors. And when we talk about risk factors, we're talking about chronic disease risk factors or lifestyle disease risk factors that are super prevalent in the Western world. Australia is absolutely no different. If you look at the biggest killers or the biggest reasons behind morbidity and mortality in Australia, you're talking cancer, you're talking diabetes, obesity, cardiovascular disease, and so on. So for obvious reasons, health checks give us a snapshot of our risks towards those killers effectively, without sounding too dramatic. But they're also, in a workplace sense, they're fantastic at inspiring change. I come back to what it is that we do, because it's a little bit like the analogy we use is that when you go to the dentist, as soon as you leave the dentist, and they probably give you a few little bonuses in your show bag, they give you some floss, and they give you some, maybe a recommendation for an electric toothbrush and so on. But for that week after seeing the dentist, you are brushing your teeth and you're doing everything under the sun to have the best oral hygiene going round. Health checks are a little bit like that as well, but we don't want it to be a short period of time that we implement that change. Health checks can be the same. If we go and we go through that health check process. Sorry, my phone's going ballistic, probably telling me that the link's not working. But if we go through that process with the health checks, particularly in a workplace scenario, we can get that information and we can then do something about that. We talk a lot about our health check programs as being coaching programs, because as you're all probably aware, the health checks don't stop after receiving that information. That's really where the health intervention starts. So the other real ability for health checks to be scaled across workplaces and to really drive wellbeing change is that they promote awareness and education. So sometimes, unless you know how your own personal wellbeing is, or you know how the wellbeing of your workplace is, it's very hard to pick the intervention, if you like. It's hard to select, well, we're going to roll out a workshop or a seminar on nutrition if we don't know the base level of nutritional awareness or nutritional health of the organisation. So it's a really nice ability to measure that and to then scale what you're doing beyond that. So that's health checks there. So the reasons that we're really sort of diving into this, and I touched on this before, is that a third of Australians have at least one chronic disease risk factor. So I'll say that again, a third of working age Australians, I should say, have at least one chronic disease risk factor. So that, as I said before, that can be a risk factor to cardiovascular health, diabetes, obesity, cancer, etc. So that, literally all of us on the call here, a third of the people that we work with have one disease risk factor, and will suffer from at least one chronic disease at some stage. 1 in 5 Australians have 2 or more chronic conditions. So that's looking at the broader population, not just the working population. So we spend a third of our lives working. Okay, that might sound a little bit depressing, but we do spend a third of our lives. So time-wise, we spend a third of our lives working. So if you really bring those factors together, not only do we see that the workplace is massively responsible for health behaviours and health awareness. I'm going to touch on all these huge statistics that we've got later on about our health checks and skin checks that'll blow your mind as much as they do mine. But if we add all of those factors together and we look at the cost, so we spoke before and we said that a third of working age Australians have at least one chronic disease risk factor. For every employee that has one chronic disease risk factor or more, that's an annual cost to the workplace of $2,618. So I'll say that again. So for every employee that's on our books, or I shouldn't say on our books, but every employee that works for our organisations, there is a cost of $2,618 for every one of those employees that has a risk factor. And that's a third of them, basically. So when you add it up, again, I'm labouring the point here a little bit, but when you add it up, there's a significant reason, not just for the, for the goodwill and for the benefit of your people, and to avoid sickness and to avoid some of these chronic diseases, but the actual cost in paying for this as a society and also paying for this as an organisation is huge. So I rest my case, but it's just really to give you guys a bit of an idea of why this is so important. As I said before, jump in as well with any questions. I believe I already, and this was before I was freaking out that no one was on the call, in the chat box, you'll see I've already popped in a link in the chat box. That is a link to our health checks. Basically, it's, are you ready for workplace health checks? And you can take a test that asks you a few quick questions, and you can work out whether or not you've done health checks or whether or not you're looking to do them. Are you ready to deliver those? So already in the chat box, there should be that. I can see someone has just added other slides available. Yes, Nathaniel. Thank you so much for jumping on. I was just going to say I've recorded this because of I was recording it anyway, but because of the issues at the start, I'm recording this and we'll be providing you guys with a link. So if you do need to jump off because I'm massively late today, feel free to do so. Yeah, no worries at all, Alison. Everyone else had the same issue. That was our fault. So the link was incorrect there. So don't worry, it wasn't you. I'm recording this anyway, and I'll be, getting in touch with you guys cap in hand to apologize with the recording, with all the resources out of today as well. So don't worry, if you need to jump off at any time, please do so. Also use this chat box as well. I think I haven't done that because I had to restart the meeting. So I'll whack in the chat box the link to the to the health check scorecard. Let's keep powering on though, for those that are still on. So why deliver workplace health checks? There's 2 reasons really. The first reason is for the employees, and it should always be around the employees. I touched on before, my background is one-on-one healthcare. So as a physiotherapist, I've consulted literally tens of thousands of employees, and in half-an-hour consultations, the outcome is getting that individual employee better. It's the same with everyone that works for Pinnacle Health Group. Has either come from that similar background, or they've worked in fitness centres, or they've worked in as a health practitioner in some way. So the first and foremost reason behind delivering health checks is to improve the well-being of employees. And how it does that is by creating awareness and improving their own personal health. So that's the first reason. The second reason is more of a collaborative reason for delivering health checks. And that's that health checks provide, as I've touched on a few times now, they provide an insight into the aggregated health data of our workforce. Or in other words, they tell us how healthy or unhealthy our workforce or our employees are. So when you bring those 2 reasons together, obviously it's very important to do that, but you guys on this call may be more in the second camp first and foremost, because you've probably been charged with that responsibility to deliver these. but also you're an employee yourselves, no doubt. So you're getting both of those benefits and both of those reasons. So let's dive into each of those points and look at the why in a bit more detail. So let's say I'm an employee of an organization. So let's say I work for a large organization within Australia, and it's been COVID for a couple of years. I've barely been to the doctor in 2 years. So I haven't really sort of had my regular checkups, and I haven't done much in that time. I then get an email out that comes out through the internal comms and says, hey, Josh, in the next couple of weeks, we're running health checks at our organization, or we're running skin cancer checks. Here's the link to book in your appointment. Jump in and you'll find out all this information about yourself and about your health and well-being. So for me as an employee, just to really dive into that as kind of a hypothetical example, I then, not only do I have the access to get that information, but I know that my employer is thinking about my well-being. They've encouraged me to do something that I haven't done probably for 2 or 3 years. And I'm going to book into that. It's frictionless, it's paid for, and I can book in, I can get that information. So straight away, again, our whole business is built on this exact philosophy, but I'm encouraged to do something about that. I'm inspired to make some healthy change right there and then. So that's really kind of cutting to the chase about the experience that the employee gets. To give you an idea, and for some of those that might have heard me talk before, I use this statistic quite a lot. Skin cancer checks are a huge health check, the type of health check that we deliver, and I'll go into the differences between skin checks and health checks in a moment. But there was a point after the first couple of years of us delivering skin cancer checks that over 70% of employees that were getting skin cancer checks through us. So I'll say that again. So over 70% of employees that were getting skin cancer checks through Pinnacle Health Group, it was their first ever skin cancer check they'd had done ever in their life. So they'd never had anyone look at their skin and look at the spots on their skin to identify which were potentially cancerous or which were suspicious lesions that needed action. So that just gives you that idea, to come back to that example of receiving the email, booking it online and having that health check conducted, that it's such a powerful thing, because, we don't do this. Unfortunately, we'd love to think that we take action, we're really organized every year and we get our regular checks, but we often don't. So the workplace is a huge, it's our most frequented environment, and it's the place that we can really inspire that healthy change. So anyway, I've said enough about that, but I think it's really important. I could talk about that for hours, about the importance of it. Okay, employers. So this is now getting to you. If you're on the call here and you're thinking, well, what do I get? So yes, I'm also an employee, so I'd be the same. I'd love to know about my skin. I'd love to actually go through that health check process and work out where I'm sitting personally. But it's also my job to do this, and what information do I get as the health and wellbeing manager or the health safety and wellbeing officer, whatever your role may be, HR. You also want to know the numbers. Not just, you don't, unfortunately, not unfortunately, but you're not allowed to know the individual personalized numbers of each and every employee, but you are provided with a de-identified report of the health checks. So what that means is that if 100 of your employees go through health checks or skin cancer checks, you'll know how many of those, obviously 100 employees had those checks conducted. The demographic breakdown, so you can kind of see some screen grabs of sample reports here that we've put together. You'll see how many of those employees was their first ever health check, which you can see in this example, 63% of the males, it was their first check, and 62% of the females. And you'll get that snapshot. So you'll see, what was the cholesterol breakdown? Was it normal, not normal? How many of the population were eating enough vegetables? 5 servings a day of vegetables seems a massive amount. That's normal. So, and what it then does for you as the employer or the decision maker around the wellbeing program is it allows you to target your wellbeing resources or your wellbeing spend on areas that need attention. So that just gives you that snapshot. So not only do the employees get that benefit, but you as the employer, you get a really detailed and comprehensive report, but de-identified, as I said before. Okay, so that's sort of the 2 reasons that you do health checks. And again, I'm not. Hopefully, this isn't coming across in a way that's saying you need to do health checks now or you must do them. It's just explaining why they're so prevalent. As you can say here, that corporate wellness, such a huge topic area at the moment, and it is as I said early on in the call, it can be quite overwhelming. Really, to give you an idea of where it sort of fits in, and context here though is it's 2018, 2019, but the most recent sort of detailed IBIS World Report is saying that health checks make up nearly 40% of corporate wellness by service. So that's obviously a significant amount. It's only going to get bigger, but it's really, we're going to see a lot more continuity, if you like, a little bit like how I was describing our coaching programs, where health checks and education and training become one and the same thing, or health checks and fitness programs become one and the same thing, in that you don't just assess, but there's a treatment and an intervention involved with that as well. Okay, so if health checks are making up nearly 40% of what workplaces do for wellness or well-being, what are the most common workplace checks? You can see there. So biometric health checks, or the classic sort of heart health check, as it's referred to, make up nearly half of those. Skin cancer checks, nearly 30%, but they're on the rise. So to give you an idea, whether you're dialing in from Australia or New Zealand today, 2 out of 3 Australians or New Zealanders will be diagnosed with skin cancer by the age of 70. So I'll say that again. So 2 out of 3 Australians or Kiwis will be diagnosed with skin cancer by the age of 70. So that's huge. We've got a pretty intense sun where we are in Australia and New Zealand. So skin cancer checks are on the rise, and they'll be much higher than that 30% in terms of that breakdown. The other classic ones, and they're probably more frequently seen in more blue collar industries, are the vision checks and hearing checks. And they're sort of making up, they're kind of competing with skin cancer checks for that prevalence. But as I said, skin cancer checks are massively on the rise. The 2 most common health checks, though, are the health checks, or the biometric health checks, heart health checks, whatever you want to call them, and skin cancer checks. So I'm just going to talk about those to give you an idea. I know we've got a small sample size because of my stuff ups, but I think probably 2/3 of us have already done health checks before. And most of those people are probably familiar with the classic sort of, it's a pretty intense image there, but the pinprick heart health check, it includes the blood glucose test, the cholesterol. It looks at waist circumference and hip to waist ratio. It obviously looks at blood pressure. It asks a lifestyle questionnaire on various parts of your well-being. So it looks at alcohol intake, smoking, yes or no, vegetable intake, fruit intake, so on and so forth, sleep health. It's really a holistic assessment of your health, and it's the most common health check that we do by far. So out of those 200 workplaces we work with, it's basically the most common service that we deliver. So that's the one on the left. Skin cancer checks, as I said before, it's obviously designed to detect skin cancer. So it's a test that's conducted by dermatoscopists, which are a fancy word for saying skin cancer practitioners or nurses that have very detailed skin cancer knowledge. And they come out on site. They deliver these either on site at the workplace, or we also have options to deliver these remotely as well. And it's a head to toe assessment of any spot on the body. It goes through a skin cancer risk assessment, as well as goes through each lesion or each spot one by one, and provides advice based on that assessment. Commonly, the advice would be, here's your skin cancer risk assessment. It's moderate at the moment. Haven't found any cancerous lesions or suspicious lesions. So well done. You should do this again in the next 6 or 12 months. That's quite common. The more powerful ones, or the real life-saving or game-changing sort of occurrences from these checks are, I've detected something that I'd like you to get reviewed by a GP and reviewed and possibly removed by a GP. And that would be marked on a body chart, basically, which comes with a booklet that you saw before. And then that the employee would take that away and take it to the nearest GP that's able to do this, and then have that removed. And thank you, someone's jumping in with a question. Josh, who takes the blood samples from the finger? A nurse. Yeah, great question. Sorry, I'm sort of jumping around a little bit. Great question, Troy. With both of these examples, so both of the health checks, they're delivered by health practitioners. The health practitioners for the heart health checks, anyone from nurses, dietitians, exercise physiologists. We have physios as well that are qualified to do this, but we have over 120, or a network of 120 workforce that deliver these across Australia and New Zealand. But as I said, they're usually from that background, and they're trained in delivering these. With the skin cancer checks, they're a bit more specialised. So they have to have further qualifications in dermatoscopy, which is the detection of skin cancer. So, so you can do both. So you could be someone who's qualified in both. But yeah, to answer your question there, Troy, it's really health practitioners that are able to go through that. And keep firing away with any questions too, guys. So they're the classic health checks in a nutshell. And I'm going to talk about them. I'm open to questions, and I'll keep a bit of an eye on time, given that we started massively late. But really, you're probably familiar with some of those health checks, or maybe both of those ones that I've dived into there. You may have had a similar thing conducted at your GP. You know, it might be your classic sort of, you move to a new GP practice and they go through that more general assessment before they get into anything else. But in a workplace setting, these health checks are important for the reasons I've mentioned, but they're also just bringing that convenience factor to you as an employee. You don't have to drive to your GP to do it. It can be at the workplace. There are remote options that I'm going to talk about, but we'll do that a little bit later. So the question is really, where do workplace health checks sort of fit in with wellbeing strategy or with the wellbeing program, more broadly speaking? And as I touched on before, it's really that same sort of, using the terminology that physios like to use. It's that assess, treat, reassess, or assess, inspire some kind of change at the workplace, and then reassess. So if you're on this call now and you're thinking, yeah, I think I need to do health checks, or I know I need to do them, how do I do them and where do they fit in? Well, as I mentioned, it's really the first time you've ever done health checks. It's the first time you've got various data metrics like I spoke about before, like the overall health of the population, nutritional status, etc., etc. Then based on the information, then it's about doing something about it. So it's about, great, we've delivered the health checks, now we need to roll out some education, or now we need to incorporate a wellbeing program, or we need to really drive home our message in this part and in this part here with the wellbeing program. Then you can reassess and look at change between the two data points, okay? So taking that a step further, a lot of workplaces, and this is, you know, probably our signature is a 12-month wellbeing program. A lot of workplaces map out a roadmap for the year, or they have their own wellbeing pillars, and they kind of ask the question, well, where do health checks fit into that? You know, at what time of the year do we do them, or how do I tie this into stuff that we've already got going? And it's a really good question. It's something that we spend most of our time working on. So we encourage health checks, or we encourage the health check program to be a staple part of the program, you know, throughout a 12-month program. We do have some clients that alternate. So some clients might choose to do health checks one year and skin cancer checks the next year, depending on budget, resources, etc. But ideally, you'd want to get those data points and to be measuring year on year, so you can see the impact that you've had over that time. But where does it fit into a program? Well, you might have monthly different wellbeing themes. You can see an example here of a 6 months of a wellbeing program that I've shown. And each month might have a slightly different wellbeing theme. So in March of this program, this particular program really focused on being sun smart, and that's when they rolled out their skin cancer checks. April then came around, and that was time for the flu vaccination. So the theme for April was about boosting immunity, getting your flu vax done, yes, but also here's some recipes to boost your immunity and so on. And then when it got to July, that's when they said, all right, the theme now, it's the middle of the year, and it's July at the moment. The middle of the year is our most common time for health checks. It works out that way for a few reasons. I think skin cancer checks are obviously more popular when the sun is out, but the heart health checks are common in the middle of the year, just because it sort of fits into that program. And also with people, you know, there's changes to diet and exercise and so on in that middle of the year that make it really important to kind of get them done then. But at the same time, we do these all year round. But with this particular program, July was when they rolled out their health checks, and that's where they went through those different assessments. Now, I'm just going to press the mute button again, the cough button. Give me a second. Okay, apologies there, guys. So now let's get into sort of the, you know, I guess where I specialize and our team at Pinnacle specializes, how to actually do health checks at your workplace. So let's talk about that now. Before we do that, I'm going to ask you another question, because before we dive into sort of, you know, how to do it properly, let's sort of sit in, you know, if you're someone who's tried health checks before at the workplace, or you've sort of done them, or you haven't done them, but they've been done at your workplace and you don't know really where to start, there are some challenges there, and I'd love to hear from you. You know, you guys that are left on the call here, what do you see as the biggest challenges when delivering successful workplace health checks? So what are some of the things that you've either come across, or do you see right now, if you haven't done them, what are some barriers to kind of rolling these out at your workplace that you might come across? So just jump on the same menti.com, the same code. This one's going to ask you just to type in your responses there. So rather than a multiple choice. So, and as you guys do that, we'll see some responses come up there. So yeah, just go to Menti. Yep, buy-in, love it. Yep, kind of the same thing, isn't it? Buy-in, participation, engagement. Thank you, guys. Time constraints, yeah, that's huge. Thanks, guys. Keep going. And by the way, I know there's only a few of us on the call, so I won't be expecting a word cloud the size of some of the clouds outside. Exercise adherence, yes, good. Dietary adherence, yep. So that's really about actually sticking to what has sort of come from the health check. So sort of the ultimate outcome. I like that. Keep going. I'll give you another sort of 15, 30 seconds or so to go through that. Thank you all so much for contributing there, and also for hanging around. Very much appreciated. Good. Well, let's keep going. So they're awesome. And yeah, as I said, roll this session out either monthly or sometimes every 2 months. And the common challenges are, yeah, massively time constraints. And that depends on the organization, but no doubt wellbeing programs or rolling out health checks aren't the only thing that you do as a role if you're in that space. And it's certainly, we have a client avatar that we call Sally. And Sally is a very busy HR or health and wellbeing coordinator that not only has to roll out a wellbeing program that juggles so many different things at the organization. And we've met hundreds, probably thousands of Sallys in our journey, and we know some of those challenges that Sally has, and the time constraints, the budget constraints, the leadership buy-ins. So buy-in's a really good one. I like that, because it's not just buy-in from staff, but it's buy-in from the leadership team that ultimately probably champion this and allocate budget as well. And yeah, participation, getting bums on seats. So, how frustrating it can be when you go to this great effort, you build out these pillars, or you map out a 12-month program, and then is that COVID again? Is it? I think that says, yeah, COVID again. Yeah, it's a really good point. We shouldn't. So we need to address the 11 in the room as well, which is COVID and coming out on site, which I will do that. So, but getting bums on seats, it can be really frustrating when you go to this effort to build out a wellbeing program and employees are not engaged in it. So again, I'm going to talk to you in a moment about how to do that. But yeah, thanks so much for those responses, and it is very reflective of what we see at a bigger scale. Now, this was where I was going to share with you. I thought I'd already done it, but I might just grab the link to this, because it is, maybe I've deleted it. I have. I'll actually follow up with this one here, because I do have a link to the scorecard to complete. And basically, we've got this really cool scorecard that you complete. You basically take the test. It tells you how ready you are to roll out health checks at your workplace. So it goes, ask you questions like, have you done this before? Do you have any data points already? Is there a room on site that we can deliver these from, and so on. Oh, no worries, Troy. Thank you, and thanks for jumping on. And I'll let you go see your client. Thank you, and apologies again.
Sorry about that, mate. Thanks, appreciate it. It was awesome.
No worries. Thanks, Troy. Hope you got a bit out of it. Thank you. So yeah, what I'll do, guys, because I've struggled to multitask here a little bit, I'll pop the link in before we jump off today, and I'll also send this out along with an apology for the link stuff up following this session, so you can all jump on and take this test. It's it's a quick and easy test, but it just kind of goes into the practicalities of, what sort of workplace health check program should you roll out now, and are you ready for it? So cool. Let's keep moving along. Okay, so how to roll them out. it sounds like a fairly obvious thing to say, but selecting the type of health check. So how we go about this with our clients is that we usually sit down in our first session. So a client has either inquired specifically with us around health checks, or they've inquired around just employee wellbeing, or that for some reason that they're on a Zoom call with us or in the room with us and we're talking to them. The first question we'll ask is, well, what do you already do at your workplace, or what's in place in terms of workplace wellbeing at your workplace at the moment? Based on, we'll ask a whole bunch of questions. We'll go through that scorecard that I mentioned before. We've got some other tools that we use to measure how successful wellbeing is at that workplace. But basically, through that consultative process, we'll then work out, all right, what type of health check is the most relevant, or what are you ready to roll out at the moment? And you'll select that health check. So let's say it's skin cancer checks. Well, then based on the selection of that, be able to provide an estimate of engagement and budget. So again, this isn't us doing it for you. This is something that you, whether you go with us or you go with anyone else, the next step is really to work out, all right, well, we're going to do skin cancer checks. How many of our X amount of employees do we think are going to be engaged in that? And therefore, what's it going to cost us roughly? So that's probably stating the bleeding obvious here. We've got a system that we can work that out. General rule of thumb, our average engagement of our programs is 38%. So general rule of thumb is that we normally work it out on 30% for organisations over a certain size. For some smaller teams and organisations, it tends to be higher than that. It can also vary based on how distributed the workforce is geographically, so how many different branches or different sites. But basically, we've got a way that we can work that engagement out. But if you're wanting just a really rough rule of thumb, let's say 30% or say a third of your workforce will take up health checks or skin cancer checks. Based on that, you'll then be able to work out a budget, or the provider that you're working with will be able to sort of provide that budget. And then, as I mentioned before, if everything's gone okay, you know, we as Pinnacle Health Group have sat down, you guys go, yep, I'm on board, let's do this. The next meeting after that is the logistics meeting. And that's where we plan out. We don't just plan out, cool, this is what we're going to do and this is when we're going to do it. No worries, Alison. Hey, thank you so much. Okay, well, thank you. We'll turn that one into a working meeting next time, but appreciate you jumping on, and apologies before about the incorrect link. So thanks so much, Alison. And same goes for anyone else on the call. If you do need to run off, given my late start, no offense taken whatsoever, I'm going to keep going so I can record this properly. So the first meeting, as I said, we'll go through the logistics, it'll go through the dates, it'll go through the locations, things as specific as rooms on site that we can roll those out at. I touched on before the ability to do this remotely. So there is a virtual health check that we can run as well. So in that logistics meeting, it might be which employees will need a virtual access to that as well. But after all the sort of nuts and bolts logistics, then the real kind of thing, you know, we all spoke about before about engagement and participation and buy-in, then it's all around the comms campaign and the promotion campaign, because that's the thing that's going to get bums on seats. And I share a story. The AFL are a client of ours, and I do share this story quite a bit because it's probably the best example of how a really good comms campaign or promotional campaign can maximize engagement. But long story short, AFL are a client of ours 5-6 years ago. They had one of their AFL players at the time actually had a melanoma. So he was out from the game and he was missing football because of skin cancer. So already that was a significant reason that engagement was increased. But we rolled out an engagement workshop. So we basically had the CEO of the AFL as well as a skin cancer practitioner from our end, gave a talk on skin cancer and the importance of it. And because the AFL player was going through that at the time, sort of referencing, you know, the struggles and the challenges that he was going through. That particular campaign, out of all of the AFL employees across Australia, 82% of employees actually had a skin cancer check done. So that was the best ever campaign we've ever rolled out, you know, for that size of an organisation. And I'm not saying that you all have to utilize some kind of semi-famous person to roll out a comms campaign, not at all. But our programs include a workshop either before or after the campaign with things like skin cancer checks. It's a really good idea to have it before the campaign because you're explaining to people what the health check entails or what the skin check entails. You're talking about the importance of it. You're refreshing their memory of when it's on. But also you kind of, what's the word? Sort of allaying any fears of why you're going through that check. So, we often get questions like, do I need to get down to my jocks, and will it be private, and all those sort of things. So you can kind of nip in the bud some of those frequently asked questions as well. So anyway, the point of what I've digressed a little bit there, but the point of what I'm really banging on about is that having a really structured comms campaign that we provide you with, by the way. So we go, here's basically a cut and pasted template of how to get this out to your staff. And we'd recommend this workshop, and we'd recommend doing that sort of 2-3 weeks out to get the best engagement and so on. Anyway, that takes us up to that point in time. We obviously provide the online booking links for those. Comms go out. It's not uncommon for the health check slots or the skin cancer check slots to be booked up in half an hour or an hour. That happens a lot. And it's a really good result, because it means that employers have gone, yes, that's definitely what I want. Thank you for sending me the link. I'm going to book in. Don't worry, it doesn't mean that everyone else misses out. There is the ability to take wait lists, and then based on demand, increase days, increase half days of skin checks, health checks, that sort of thing. But anyway, that gets sent out. Following that, we obviously then come out on site, or we go through the actual health check. So that might be on site is the most common form of delivery. Even throughout COVID, it was the safest way to get people on site in a COVID safe environment and deliver these checks. It was affected for obvious reasons, but now we're sort of really back in the swing of things. There are virtual ways to do this as well that I touched on, but basically we go through the health check campaign. So that might be 4 days of health checks, or 3 days of skin checks, or 15 days, or 50 days if it's a large organization. It's delivered. As it's delivered, the employee that's receiving that health check gets their booklet, gets their information live in person. They get asked a series of questions. They'll get a little report that gets sent to them as well. And that's what the employer receives. Following the whole program completion, you as the employer, if that's where you're from on the call, or the workforce generally, get the de-identified report. So they get the snapshot, the 100 employees, this was the overall report from that. And we book in a session, and our team go through the data. We don't just go, here's the report, make sense of it if you like, and call us again if you want to do these again. We actually book in a meeting with you. We talk through the results. We talk about the success of the program, and talk about what we'd recommend based on that. We talk about how your engagement ranked compared to other organizations, and talk about sort of what the next steps would be. Because as we said before, it's employee wellbeing doesn't, start and finish at health checks. It's certainly one piece of the puzzle, and it's really what you do next and how you interpret those results that makes the biggest difference. So anyway, that's sort of the how. That's really the where the rubber hits the road, I suppose. As I said before, average engagement around about 30%. Really, in sort of the finer details, we need to know space and privacy requirements, on-site versus remote options. On-site is the gold standard, and it's still what we preference over anything else. We also like to understand the various communications channels that you might have at your workforce, so we can get comms out rather than just an email out. Do you have a digital wellbeing platform? Do you have a social media channel that we can get it out on? Can we get a champion, or even still, can we get like the CEO or one of the leaders to say a few words in a town hall meeting, or can we get buy-in from one of those leaders to show that this campaign is coming up? I'm going to be involved in it as the leader. I suggest you do too, because we do often find this. I'm not sure if you do, but a lot of policies, an example would be like the parental leave policy. There's these amazing things in place at workplaces, but the engagement in them can be quite low. And a lot of staff might still be like, it's there, but am I really allowed to do it? Is it something that everyone's doing it? What would the CEO think if I took 3 months, paid parental leave now? If these things are in place, if health checks are in place, leave policies are in place, it really needs the leaders of an organization to show that they're not just there to tick boxes, but they're there for a reason, and that you should use them. So anyway, I do digress again, and I've gone on a passionate rant, but that's something to think about as well. And also considering incentives. So, we have a digital wellbeing coaching program that we use that actually incentivizes. So it's linked to health checks. So it actually incentivizes. So if you book in your health checks, or if you go through a workshop or anything else, you get reward points that are then tallied up to get wellbeing rewards at the end of the year. You could consider that as well. For everyone that books in for a health check, you'll get X or Y, or you'll get access to this. So there are ways to really incentivize engagement and participation as well, because as we all agreed before, it's one of the biggest barriers. So with the broader wellbeing program, sort of where does this fit in, and how does it sort of, I guess, impact the broader wellbeing program? Now with our 12-month wellbeing programs, we have a 5-step system to roll out successful wellbeing programs. I won't bore you with all the details of that, but the 5-step system is really to have a structure around the program, to make sure it involves psychological support, to have a strong awareness backing that I've spoken a lot about. So that's communications, that's having various channels, to have champions within the organization that help to roll that out, and then to evaluate the success of the program. So if we think about where health checks fit into this, well, health checks can be just one campaign or one smaller program, a part of the bigger wellbeing program, but they also do fit into the evaluation piece if you think about it, because it's very rich in data. We're getting not just attendance numbers and great, we did this, so because 30% of people came along, we think we should do it next year, but we're actually getting real health data from the health check. So it is a part of that, a big part of the broader wellbeing program. As I said, we have a 5-step system. We also have a scorecard on your holistic wellbeing program that you might want to access as well, which I can share. Okay, now finally, thank you so much for hanging around, and we're probably getting towards the end where I might get you guys to jump in and ask questions. Because you've been so patient and hung around, feel free just to grill me on anything, because again, I've probably talked through it quite quickly today, given all the stuff ups. But just finally to round this out and looking at, we're in the year 2022. It's, the work and life sort of crossover has never been as big as it is now. And that integration between work and life has been quite hectic for us for the last couple of years, but also there's been lots of positives come out of that. But really, workplace wellbeing as a broader topic beyond 2022, hybrid working is certainly going to be something that is around for a while, if not forever, for some organizations, i.e. the ability to work from an office, but also from a home or from anywhere, and being flexible with that. It's not applicable to every organization, and there are some organizations that don't have, dare I say it, that luxury. But flexibility, being able to, in the context of this, being able to kind of scale wellbeing, not just to the fancy head office buildings where most of our workforce are, but how to access, how employees can access wellbeing when they might work in an office of 3, or they might work from a co-working space, or they might be working from home mainly. How to get wellbeing out to them. The other parts that we spoke about engagement before. So yeah, absolutely. Beyond this year, well, it's a huge factor already, but beyond this year, engagement's going to be even more important, because one, it's going to be more challenging because we don't have captive audiences of 9 to 5 as 5 days a week. But to justify why we're doing the things that we're doing in a wellbeing program, we're going to really have to have strong engagement data to justify that. Behavioral change versus education. So kind of coaching versus telling would be the way to describe that. Workplace wellbeing, that it's been hugely saturated in the last couple of years. Lots of clients we speak to have been through a bit of wellbeing fatigue, which is where their employees have said, look, we're just about done with webinars on wellbeing at the moment. Please spare us just for a moment. What else have you got? So telling and just constantly sort of noising employees around being healthier, while as well-intentioned as it may be, is not the way to do that. It's around coaching, it's around habit creation and so on. And really looking at wellbeing and performance tied in. It's kind of the analogy I use with this one is sort of, it's almost like I've got 2 young kids, and it's almost like disguising vegetables as part of a big lasagna. You kind of, or a bolognese, you need to, the analogy here, so this is such an obscure reference, but rather than telling people, hey, you need to be healthy, do this, or we've got an EAP program, you should look after your mental health, is going, improve your performance, or feel better, or get fitter, or it's more looking at the proactive or the preventative side of things rather than the negative or the medical term or the really, telling kids to eat their vegetables analogy. So there's sorts, we've got so much data on this, but basically if you're looking at how's wellbeing going to work moving forward, it's really looking at those factors, and to finish off there, it's making it accessible to all. So it's not just as I said, the typical sort of head office employees get everything and the others kind of, you know, a bit piecemeal. It's making it truly accessible to all and equity of access. So, and as I said before, really just to summarize this, and again, apologies if this has seemed quite disjointed and jumping around. I was obviously a bit stressed at the start of the session, but really what I want you to take home, if you take nothing else out of today's session, apart from that health checks are important and there's a few different ways you can do them. Behavioural change is the main focus really moving forward. How do you instill behavioural change? Well, one of the first ways to do that is actually to get some data, i.e. do health checks. Convenience is still king, so that, you know, 71% of employees have never had a skin cancer check done outside of the work. Why do they do it? Because the workplace offered it. Wellbeing, personal development and training, so sort of building it in, looking at the kind of development and the performance rather than talking about health and wellbeing all the time. Champions and engagement. So really sort of how do you get buy-in through that network that you've got at your workplace? Okay, well, thank you so much for hanging around to the end of the session. Again, sorry you had to, go through all those issues at the start. If you're listening to this recording, thank you for listening to the end as well. I'll hand over to you guys now if you like, and feel free to ask me any questions, and anything that hasn't been answered today, I will send you through a link to the recording. I'll send you some other resources as well. And once again, thank you so much. But yeah, jump in the chat box, guys, if you like, and I'll answer any questions.
Thanks, Josh. That was great. I just have to jump off now, though. So thank you for your time.
Thank you, Lauren, and thank you for emailing me. I thought it was weird that no one was with me at 12:31. So thanks so much. Appreciate it.
No worries. Bye.
Cheers. Bye. Thanks, Maureen. Thanks, Sharon. Yeah, they are. Thanks, Linda.
I don't have any questions, but thank you for that. That was super helpful.
No, thank you so much, Nicole, and thanks for hanging around. I really appreciate
no worries.
that.
All right, thank you.
Have a good day. Catch you later.
Bye.
Bye.